Hi Patrick, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And we're going to start by looking at the biceps tendon. You're laying on your side, so your arm is sticking up in the air, which is why the socket is down below here, as you see, and the humeral head is up above. So here's the biceps tendon. It's a little bit frayed. It looks like normal wear and tear changes. We can look at the biceps insertion. On the MRI scan, this was actually read as a slap lesion, but this isn't the type of slap lesion that we typically have to repair. It's what we call a type 1 slap lesion. It's more degenerative, a lot like a degenerative meniscal tear. So even though it's read as an injury on the MRI scan, we don't really typically have to do any surgery to it. We're going to look at the rotator cuff tear next, and this is really why we're here. See the hole in the tendon here? So here we've got a hole in the rotator cuff. We're going to turn on the shaver here just to identify it and clean up the edges a little bit in anticipation of fixing this. We're going to anchor this back to the bone, so an hour from now this will be fixed, and then the rest of the time is just spent on healing and rehab. But the main thing for us right now is to get this repaired back to the bone right there where it's torn. Hold the shaver, please. So we're going to rotate around, look towards the back of the shoulder, just to make sure there's nothing else inside the joint to worry about. Here's posterior capsule, that looks good. You can see a little bit of fraying in the labrum. So again, this is read as a labral tear on the MRI scan, but not a labral tear that requires reattachment. It's not from instability, it's not from dislocating. It's part of the normal wear and tear changes that we get, but we can smooth it out a little bit. Just to give you an idea, those little areas there are just millimeters in size, far less than a half an inch even. As we look down the front of the shoulder, you can see the anterior labrum. I don't really see any significant problems to worry about. Anterior capsule here looks good, so that's all encouraging. You can see the middle glenohumeral ligament crossing here. That's the middle glenohumeral ligament that I'm touching. Behind that would be the subscapularis tendon, running up kind of towards 11 o'clock on the screen. And we know from your physical exam and from your studies that that's okay as well. You can hold the shaver. And so now we're going to rotate and look. That's going to be the rotator cuff injury. We're going to go ahead and get to work. We're going to change positions with your shoulder in just a minute here. Okay, so we're in the subacromial space. This is all part of the torn rotator cuff. It looks even worse from this side compared to the articular side. We're just going to start to clean things up here so we can see. So the area of the shoulder that we're working on now is called the rotator cuff footprint. This is where we're going to be reattaching the tendon back to the bone. We're getting a little bit of bleeding, but we'll deal with that in just a second. Okay, so here's the tear. I've got a little instrument on it just to check how flexible it is. And we ought to be able to get that down to the bone. You can see it's a little delaminated on the dorsal side. So we'll try and incorporate all of that into the repair. So we're going to start by taking a spinal needle here in just a minute. And we're going to check our angle, make sure we have a good angle to place our suture anchor in. So here's our spinal needle. That looks like a pretty good angle. The smooth white stuff, that's articular cartilage. And so if you go down this way, that's going into the joint. You can see the biceps tendon there as it comes into the joint. And so we're going to start from here and come back about 4 or 5 millimeters, which puts us right about here for our anchor. That's going to leave us a little space laterally to make our little bone marrow vents also to try and promote a healing response. So we're going to go in right about here. Our guide, we're going to start at the articular margin. We're going to walk it back again about 4 or 5, maybe 4 or 5 millimeters right about there. We're going to make sure we have good coverage here. And that looks pretty good right about there. So we'll go ahead and pull that. We'll place and then we'll mallet this down. See the anchor in the bone. We're going to pull back on the sutures because that seats the anchor. That looks very good. And so now we're going to reach in from the right side of the screen, which is the front of your shoulder. And we're going to take out the most posterior suture. Looks like we can work with this. We can work with this tool. So hold the great camera. So we'll pull that out. Now we're ready to go. We're going to take a pincher tool and put that in the great cannula. And going to use an instrument called the suture hook that you see coming in here. The suture hook is loaded with a black wire called a shuttle relay, or called a super shuttle now. Okay, hold the camera here. We're going to get a big bite. We're going to make sure we get through the superior surface where it's not delaminated. Hold right there. So we're going to start back here, push down, rotate, and we're going to look for it to come out down low here as we pull this forward. And there you can see it. So that's a good bite. So we're going to go ahead and feed that through, and we're going to load that with a suture here. I'll show you some more in just a minute. Pulling back on the suture, you can see it's going to go underneath. That looks great. And now I'm going to reach in with my crochet hook. Okay, so now we're going to reach in and decide how to take out this other blue and white suture so that we don't have any twists. I think that looks pretty good right there. I don't think we're going to tie that. Yeah, we will. We'll tie that one. That'll give us a good anchor point. We can judge the rest of the tear after that. Got the first knot tied right there. You can see how it's brought over that tendon. You've still got a delaminated portion here that it's about to get repaired because we're going to snug this down just like that. And that's going to take care of that. Here's what's left of, here's what's left of the hole right here. There's the biceps tendon, just to give you an idea of where we're at. So we're going to make another stitch using what we call a turn to the right suture hook. We'll show you that in just a minute. So I think we're done. We actually ended up placing two side-to-side stitches. We also call those ripstop sutures because they prevent the tear from propagating. The hole is completely covered up, and you can see it's all moving together as a unit right here. This is posterior on the left, anterior as I rotate the scope, anterior is over here on the right. And I'm very happy with the way that's come together. The last little piece of the repair for us is to try and use a little bit of biology to stimulate a healing response. And I know we've talked a little bit about that in the office. We're going to take this instrument called a punch, and I'm trying to show you. This punch just makes some little holes in the bone. Now, there's the punch. I slowly bring it back here. You can see where it is, and we're just going to tap into the bone there. All the way down. You can already see some of the marrow. A little more. Okay. So that releases some of the marrow elements. There's stem cells in there, growth factors, other things involved in the healing response that I think are helpful. So we've got the punch in again. We're going to make another little hole over here. Okay. These are way lateral. They don't involve our anchor position. And we'll make one more over here. Okay. So now we've got some holes. You can see them there. We're going to go ahead and turn down the pump pressure. We're going to get you back to the recovery room in just a few minutes. Really hope this does the trick for you. It looks like it's going to be a stable repair. And there you can see some of the marrow elements coming out of the little holes we made. So good luck to you now. Bye-bye.